but I can honestly say for me it was a breeze because my airline travel was exceptional. My flights were running on time, which made it nice because I got here on the time that I told the people who were meeting me at the airport. So I thought that made it really nice and relaxing. But when I got to the clinic, I was really relieved because the trip had been very smooth, but the clinic was actually really a lot nicer than I thought and a lot bigger than I thought. And so coming through the doors of the clinic was very relaxing.
Okay, and after you arrive here and have had transferred to the clinic, you have the consultation with Dr. Veklich regarding the bow legs correction technology and everything.
That's right.
And did you understand everything clear that Dr. Veklich explained you regarding the procedure from the beginning till the end?
I did. I had a pretty good understanding of the whole procedure through asking questions before coming here, and it was very comforting to sit down in person with Dr. Veklich, meet him, because he's very passionate about the corrections that he performs here at the clinic. Obviously, that made me feel really good because I thought that he really cared about me as an individual. And you know, sometimes in medical care, especially in the U.S., you don't feel that connection because everything moves at such a quick pace. But here I felt like I was cared for initially and beyond as a true individual who had an issue that really needed to be addressed to, you know, for me it was a way to right a wrong. I mean, when you have bow legs or a deficiency or discrepancy, you didn't ask for that, and to be able to solve the problem is really life-changing. And so Dr. Veklich made me feel a lot better about the life-changing procedure that we were going to do. And so yes, it was a lot less stressful than I thought.
And after that you arrive, yes, the Pavel show you their interviews of patients that gave that interviews regarding their experience before. So was it helpful for you just to make sure everything okay?
Absolutely. I mean, you know, seeing truly is believing. And in Dr. Veklich's office, I saw even more before and after pictures of patients standing right there in his office. You know, pictures of the patients over the years, and many years, who had various deformities, whether they had some dwarfism and were lengthening their limbs, had knock knees and were correcting that, which is amazing, and then multiple bow leg corrections with the results being outstanding. And I want to add too that one of the reasons I came here is because looking at persons who could fix this problem, I felt Dr. Veklich's aesthetics and the results that he gets when he makes the correction, they look a lot better than other corrections. They, anatomically speaking, the legs look like you were born with those legs rather than they've been manipulated. So seeing the interviews that Pavel offered, and which were really enlightening, and the before and after pictures, and even meeting a couple of patients the day after I arrived, was really wonderful.
I see. How was your talk with anesthetist regarding all the procedures before your surgery?
Well, I really enjoyed. I believe my anesthesiologist is Maxim.
Maxim, yes, that's right.
Very, very nice gentleman. Very calming. Again, he was very personable and seemed to really care about me, and gave me the time to ask questions with Pavel's help. Although the anesthesiologist spoke a little English, I had comfort of understanding through Pavel anything that I couldn't understand or that he couldn't understand. But I've had a couple of procedures over the years that required general anesthesia, shoulder surgery and things of that nature. And I can honestly say that the anesthesia here was one of the initial highlights of the procedure, because it was a non-event. It wasn't painful. After my procedure, I came out of the anesthesia very well, and was quite pleased at the level of care that the team provided in the operating room. Looking back on that, as I've been here for a few weeks, that was one of the nicest things about the procedure, was the team effort, and the anesthesia was wonderful.
How you just explain for the people your steps doing just before the surgery? So looking how you feel yourself going to the surgery room, and looking at what procedure is done for you while you were on a surgery table. What did you remember about that?
I remember Pavel took me the day of my procedure, which was the second day after my arrival. We went to the operating room, which I had already toured prior to the day of the surgery, and had a comfort level with where I would be having my procedure. Pavel took me to the operating room. The team was working on everything and getting things ready, and Dr. Veklich was making preparations, and the anesthesiologist started working with me and doing the preparations for anesthesia, and I have no memory really of anything after that. Once the anesthesia preparations were made, the only thing I recall is just being placed in this bed after my procedure comfortably with the apparatus. When I woke and was clear-minded, I remembered why I was here and what I was doing, and immediately saw the apparatus on my legs to make the correction. So it was painless and easy to. I would tell someone to not be stressed about the whole ordeal, because it was the easiest. It's actually easier than having your teeth cleaned by a dentist. I'm kidding not, as far as stress and discomfort. There was no discomfort, so that made it really nice.
And the question is, because with the anesthesia, spinal anesthesia, you don't feel any pains during 4 or 5 hours after the surgery. How do you feel yourself while the first pain appears? What level of pains you have? So because this is one of the important moments. People sometimes very sensitive to that question, to the pains.
I think that's a really good question. And first, let me say it's true. The spinal anesthesia that was provided for me in conjunction with the general anesthesia it was my first time to have a spinal anesthetic, and I was pleasantly surprised that, again, there was no discomfort in receiving that anesthesia at all. And when I awoke, you're correct, it was 4 or 5 hours of total comfort, which was nice to make the transition, knowing that anesthesia would wear off, and it was explained to me that there would be a level of pain emerge, and that then you could start taking other medications to reduce the pain. But the pain was expected on a procedure such as this, but it was managed with pain medications. When the pain arose after the anesthesia wore off, it was a moderate pain, and then I started requesting pain medications. And my advice to anyone would be that they provide you the medications when you request them, so be sure and request them. I had a tendency to not ask for medications enough. Maybe it's because I thought I had a high tolerance for pain, which I've been told I do,